Welcome to the channel. This is the second video about reading blood test results. In the first one, I talked about the chemistry and endocrinology. So this time, it's the hematology, which is the red blood cells and white blood cells, and urinalysis. I am not at my best today. I hope you will bear with me and forgive the scruffy appearance. I will try to be reasonably coherent, which I don't always manage at the best of times. Keep in mind that I am not giving you a comprehensive reading of blood test results. This is just some of the things to look at, especially with hyperthyroid cats, but not limited to hyperthyroidism. And sometimes when you shouldn't get too freaked out by a test that's out of range, and times that you do need to ask your vet some more specific questions if they didn't already bring it up. There is a very good website for information on the different blood test readings. I will link to that in the description. Keep in mind there that since it is good, it includes some of the worst case scenarios. Don't take that as meaning it's likely. Just covering the bases. So you have to look at the big picture, the different numbers relative to one another, relative to previous tests, and don't leave the cat out of the equation. Look at their behavior, symptoms, and all of that. Get the whole picture. In the meantime, I do hope you will click the thumbs up button, subscribe to the channel, share the video, comment, tell your friends. Tell your cats too, shoot. Yeah. Give them a YouTube account and let them subscribe. Okay. With the red blood cells, mostly you are looking at the RBC itself, the HCT, which is hematocrit, and the hemoglobin, and to some degree the reticulocytes. There are some other things on there, but you're generally not going to be worrying about them too much, so I'm not going to get into them a lot at all, actually. RBC is just the total number of red blood cells in the blood. The hematocrit tells you how much iron the blood is carrying. Hemoglobin, how much oxygen the blood is carrying. And reticulocytes are new red blood cells. So is the body producing enough or too many? Okay. Sometimes with hyperthyroidism, the red blood cells will be high or high normal, and maybe some of the other numbers as well. That tends to be dehydration, which is common especially with just a very slight hyper T, very slight high T4 number. Most likely it's going to settle down once you get T4 in the mid-normal range, so you probably don't have to do anything at all. What you are really watching on the red blood cells is watching out for an allergic reaction. If these numbers start trending down towards low normal or below normal, and especially if you see a pattern over a 2 or 3 month period, it may be the methimazole. Only way to find out is by stopping the methimazole and seeing if the numbers improve. This is a known, formally documented allergic reaction. It's not common, but not rare either. And yet, there are vets out there who do not know it exists, and some who will deny it when you point it out. So That's one of the reasons why it is essential that you get copies of the blood test results every time, so you can look more closely at things and ask questions, do research on your own. But don't freak out. And it will confuse you at first, but you will become a pro at reading these tests. So watch for these. The reaction is most likely, if it's going to happen, within the first 1 to 3 months. But it is possible for it to happen at any time. 2 or 3 years later, the allergic reaction can kick in for no known reason except cats are weird. And this is when it's really harder to convince a vet that that's what is happening. Maybe it's not. You have to look at all the factors. But if you don't have some other clear reason why those numbers are going down, you have to consider that it might be the methimazole and try stopping it to see what happens. The reticulocytes, about the only thing I want to mention there is that sometimes you will get a test result that says 0, claiming the body is producing no new red blood cells, and yet there your cat is bouncing around doing fine. No new red blood cells means the cat would be at least comatose. So it's a common test error with the automated tests. It won't always be noted. A lot of times when you see an odd number, you need to read the notes either right below the number or someplace on the test results. They quite often will give you more information on why you got a weird result. So read the fine print. White blood cells. Mostly we just think of white blood cells as dealing with infection. They do that. They do an awful lot more, but the infection is what we're going to deal with mostly. Usually on a test you will get the overall WBC. Look at it, but don't trust it too much. There are many different types of white blood cells, and the test should list them separately. It may list percentages and absolutes. The absolute number is the one that you should be most interested in. And the trick is that some of these numbers can be very low and be fine, but if they are low, another number might be very high, and your average WBC or total WBC looks relatively normal or just high normal. So you got to pay attention to those individual numbers. Just running through them in alphabetical order. Basophils, you want to see 0. Normal is fine. It's really uncommon to have high basophils. If you have high basophils and high eosinophils, then you probably are dealing with an allergic reaction. No big deal. If basophils are high, eosinophils are normal, you want to talk about it with your vet because it could indicate a significant problem. That does not happen often at all. I'm not sure I've seen it in any of the groups. So don't worry too much about it. Eosinophils, high eosinophils are almost always an allergic reaction, but it can be to almost anything. It might be food, it might be fleas, it might be internal parasites, and you may never figure out what it was. You may just treat it, and if the treatment works, you say thank you and move on. Most of the time these aren't, health life-threatening issues. They can be. I mean, allergies can be a big deal. But keep a look and then have the fun trying to sort out what it really is. Lymphocytes, fairly often you will see a slightly high result in lymphocytes when you're dealing with hyperthyroidism. Sometimes with any vet trip, because stress can raise lymphocytes. Doesn't raise them a lot. So here we're just talking about a slight increase. Stress can do it. Just the stress of the vet visit, the stress that hyperthyroidism puts on the system, on top of the stress of the vet visit, inflammatory bowel disease, a lot of things can throw it off a little. If it is significantly high, then you are probably talking about infection. Again, if it's slightly high, don't assume it's not an infection, only that it might be these other things. So you kind of keep an eye on it, or you consider whether or not the cat has symptoms of an infection. I have seen cases where vets ignore very high white blood cell results. It sounds absurd, but it happens. And so, it may be because, vets are extremely overworked most of the time. They have a tendency to look at these test results fairly quickly, and they may just be looking at what they expect, what they think are the key numbers. Again, good reason why it's up to you to get the copy. Look at it at home when you have time to take a close look, and when you can kind of compare, hey, have the lymphocytes been slightly high on previous tests? If it's, then it's just that cat's pattern. If lymphocytes are low, again, it might be that cat. We usually don't know what the norms are until we're dealing with a health issue, which throws off the norms. Steroids can lower lymphocytes, so consider what meds you're using, and could be a viral infection. Viruses are weird. I think they're related to cats because they're weird. They may raise the white blood cell numbers. They may have no effect on them, or they may lower them. There is also the possibility that a long-term infection has depleted the white blood cell numbers, so the body is not able to keep up. That could be a bacterial infection doing it, but low numbers, I would first suspect a viral issue. Monocytes, pretty much any infection or inflammation can raise them. Again, slightly raised may not be significant at all. Significantly raised, you probably should be trying an antibiotic. Neutrophils, very similar situation to the lymphocytes. Don't ignore any of the results, but high, very high, you probably need to be treating with a good antibiotic. Low might be an age thing, might be a virus, and worst case scenario with some of the low white blood cells, you could be looking at cancer. Although many cancers are treatable, especially small cell lymphoma. So again, even if you are looking at a worst case scenario, don't freak out. Look at the options. Now, urinalysis. So we switched from blood to pee. Most of the time with a urinalysis, you are checking for a urinary tract infection. but it is also part of the general wellness panel. Can tell you a number of things. You're checking for glucose, checking for proteins getting loose, checking for blood in the urine, and a lot of these can be caused by hyperthyroidism or other forms of stress. So again, don't freak. See what the numbers are when you have everything else in normal range. And if you are getting blood or something like that but not finding any signs of infection, treat for stress and see what happens. Although keep in mind that some infections won't show up unless you send the urine out to be cultured. That's usually sort of a later step because it's usually not necessary. It takes up to a week. So by the time you get the results back, you may have already had to start the antibiotic and have things almost knocked out. But, sometimes it's necessary. You're also checking the pH, the acidity level in the urinary system. Cats need to keep it in a fairly narrow range, about 6.0 to 6.5. If it's off, it's usually high, which is too alkaline. A lot of foods will cause alkaline urine because they've got too much plant crap and not enough meat. It's as simple as that, really. Cats are obligate carnivores. Meat is their natural diet. They are not designed really to digest and properly use plant matter. And especially dry foods in particular have a high likelihood of causing alkaline urine. Why is it a problem? Because bacteria prefers an alkaline urine. The acidity level helps prevent bacterial growth. You don't want it too acid, but you want it acid enough. And alkaline or too acidic, either one, can permit crystals and stones. And of course, you don't want crystals and get them clumping together and causing a blockage, and then you're in a mess. So you need to keep your pH in that good narrow range and good fluid intake. Lots of water. That is, those are the two critical things to give you your best chance of urinary health. Also looking at the urine-specific gravity, which may just be listed as USG. That is checking kidney function. And it probably is still our best judge of kidney health. It doesn't catch things until the kidneys are having some pretty significant problems, but cats with, stage 2 chronic kidney disease can live for years. It usually progresses slowly. Main treatment is water intake and, improved nutrition. There are some other things, and I do have a video on some of the kidney health. I'll probably be doing more related videos. USG isn't as easily affected by outside things, but some dehydration will still affect it. So it's not an absolute, but it's a pretty good guide. So it's not, I wouldn't do a urinalysis just to check the USG. Creatinine in the regular blood test, generally helps enough. But if you're doing the urinalysis anyway, take a look at the USG. But yeah, do not let any thoughts of chronic kidney disease freak you out. Chronic kidney disease is treatable. You can do a lot to help. Okay, again, that's not comprehensive. I hope it was coherent. I hope I did not cause too much concern or confusion. In the meantime, I'll be thinking of more videos to do. Go spend some time with your furkin. And I've got somebody over there going nuts on the cat tree, so I may have to give Rhodo some attention. I'll talk to you later.